Hello, and thank you all for attending today. I'm Laurie Trungone, the Service Line Leader for Women's Health at Inspira. This program today is brought to you by Inspira's Spirit of Women. Spirit of Women is Inspira's way of reaching out to the women of our community to provide health information in a fun and innovative way. We host events on a monthly basis, including dinner seminars, girls' night out, and many other fun ways to incorporate health education into what we do. And although, like so many others, we've been forced to go virtual, we hope to return to in-person events later this year. Signing up to be a Spirit member is free and it's easy. You can sign up at inspiraspiritofwomen.org. We thought we'd change things up a little bit, and today we're offering the first of our Health Bite informative sessions. These are just designed to be fun and quick and give you a little information at the same time. Today we're using Zoom. As usual, we encourage you to ask questions using the Q&A button. Your questions will only be visible to our presenters, and your identity can be anonymous if that's what you would like. With that said, we hope you feel comfortable asking whatever's on your mind. We'll also be asking you questions here and there throughout the discussion called poll questions. This should make it fun. Today's presentation is being recorded, and a YouTube link will be sent to you so you can view at a later time or share with anybody if you'd like. And just so you know, this presentation is not intended to be a substitute for professional medical advice, diagnosis, or treatment. And although our speaker is a board-certified physician, we encourage you to always seek the advice of your physician or another qualified health provider with any questions that you may have regarding any medical condition. With that said, I'd like to present today's speaker, Dr. Sabrina Thomas. Dr. Thomas is a board-certified obstetrician and gynecologist at Inspira Medical Group. Her office is in East Vineland, and she received her degree from Jacobs School of Medicine and Biomedical Sciences at the University of Buffalo. Dr. Thomas went on to complete her residency at Greater Baltimore Medical Center, Johns Hopkins Hospital, where she was chief resident. She has over 20 years of clinical and leadership experience, including being recognized as a top doctor by Washingtonian Magazine. She has also served as a guest faculty member at the Critical Care OB Symposium. We're pleased to have Dr. Thomas with us today. And as many of her patients refer to her as Dr. Sabrina. She is a provider for Inspira, and we appreciate her joining us and taking her time out to help better understand COVID-19 and pregnancy. So welcome, Dr. Thomas.
Hi there, Lori. Hi, everyone. Happy Thursday. I'm very happy to be here today to share on this topic with you.
Very good, thank you. So here's a fun fact. All babies born in 2021 will have been conceived during the pandemic. That's a weird thought, even just in and of itself. Being pregnant already requires you to be hyper aware of your body for physical and physiological changes, let alone during a pandemic. So today we're going to go through what we know and try to help you navigate a pregnancy in these unprecedented times. So we'll start with a poll question, and I'd like you to answer true or false. Pregnant women are at higher risk for severe COVID-19 symptoms. So just true or false, and we'll give you a minute to answer that. All right. All right, so it looks like everyone thinks that that is true. So 83% of you think that that is true, and 17% of you think that is false. So let's have Dr. Thomas tell us if we're correct.
Great, so thanks for answering the poll question. So we actually know from observational data that while the chances for severe health effects are low, pregnant women with COVID-19 do have an increased risk of severe illness compared to non-pregnant women of the same reproductive age. In addition, pregnant women can, with COVID-19, be at increased risk for adverse pregnancy outcomes, such as having a preterm birth, which is delivering before 37 weeks, compared to pregnant women without COVID. So it's especially important for pregnant people and those who live with them to get themselves protected from getting COVID-19.
Is there a way to have no risk of getting COVID-19?
Yeah, unfortunately, there's no way to have zero risk of infection. So it's important to know how to be as safe as possible. In general, the more people you're around and the closer you interact with them and the longer you interact with them, you're at higher risk of getting and spreading COVID-19. So consider the level of risk when you're deciding to go out, to interact with people, especially those who don't live with you. If you do go out, ensure that you and the people who live with you are taking steps to protect themselves. And there are many ways we can do this, and we know best that if we limit the interactions with people who have been exposed to or who might be infected with COVID-19, including people in your own household, as much as possible, that's helpful. We can take steps to prevent getting COVID-19 when we do interact with people by wearing a mask, especially when you can't keep distance from other people, avoiding others who are not wearing masks, or ask them if they're around you to wear a mask. Stay at least 6 feet apart from others outside of our household. Wash our hands with soap and water for at least 20 seconds. And if soap and water is not available, Lori, we should use hand sanitizer with at least 60% alcohol content. Finally, we should just avoid activities where taking these steps might be very difficult.
That's good, thank you. So other than those steps that you just outlined for women, is there a way to prevent that they can stay healthy during their pregnancy besides just preventing COVID?
Sure. Well, always keep all of your healthcare appointments during and after your pregnancy. That's first and foremost. Visit your healthcare provider with all of their recommended follow-up appointments, because that gives us the most information as we're trying to constantly be updated about the situation with COVID. If you're concerned about going to your appointments because of COVID-19, you should ask your healthcare provider what steps they're taking to spread the infection, to help prevent spread of the infection. Here at Inspira, of course, we take the virus very seriously. We sanitize everything. We wear masks, and we keep patients socially distanced and take all of these precautions very seriously. The second thing you can do is consider getting the recommended vaccines. Getting recommended vaccines during pregnancy can help protect you and your baby. Getting vaccinated against influenza is important, and other people in your household should also get vaccinated to protect themselves and you. Getting vaccinated against whooping cough or Tdap vaccine is also helpful during pregnancy. It protects your baby against whooping cough, which can have similar symptoms to COVID-19. You should call your healthcare provider if you have any concerns about the pregnancy, or if you get sick and think that you may actually have COVID-19. And also, don't delay getting emergency care because of COVID-19. The emergency departments have steps in place to protect you from getting COVID-19 if you have that need to get care. And you should, if you have emergency situations, get emergency help by calling 911 right away. Tell them that you're pregnant and that you're having an emergency.
I know when I was pregnant, I did everything with the health and well-being of my baby, right? And that's all I kept in mind. I'm sure that's exacerbated 100 times over for women who are now pregnant in this pandemic. I'm sure women want to know, if they get COVID-19 while they're pregnant, can they infect the baby?
Well, some newborns have tested positive for the virus that causes COVID-19 shortly after they're born. It's not really known if these newborns got the virus before, during, or after birth from close contact with an infected person. Most newborns who tested positive for the virus that caused COVID-19 had mild or no symptoms, and they did recover.
Okay, that's good. Does that mean it then the virus crosses the placenta? I know that's something we talk about a lot, whether something can or does or doesn't cross the placenta.
Well, once again, we have no definitive answer to that. There's no definite evidence that the virus that causes COVID-19, which is SARS-CoV-2, we don't know that it crosses the placenta and infects the fetus. But we've had some cases where, when we look at the placental tissue or membranes after birth, it has tested positive for the same virus, SARS-CoV-2, and a few cases of in utero infection have been reported. But again, there's nothing definite.
Mm-hmm. So with that in mind, for those in our audience who are pregnant during this crazy time, you need to prepare for a safe but very different than we're used to birth experience, as with everything else we're experiencing these days, right? Just totally different. I know at Inspira, as well as most hospitals, we've implemented strict precautionary measures to help prevent the spread of the virus. There's a very strict mask policy for all employees and visitors. The healthcare team will be wearing way more protective equipment than you or they are used to in order to keep you and your baby safe. We have pretty strict visitation guidelines, and those are determined by the New Jersey Hospital Association in collaboration with the Centers for Disease Control. There are actually color codes, red, yellow, and green, as to the level of restriction. Obviously, green the least restrictive, red the most restrictive for visitors. We have actually just moved from red to yellow. It was either today or yesterday we moved to yellow, and that means, and it's all based on the demographics of where geographically the hospital is, and then the surge level in that geographic area. So yellow means that you can have one visitor, one at a time. Now in red, it was only your support person and a doula if you had a doula. Labor and delivery and the OB area has always been allowing a visitor or your support person. So even in a code red situation, we still allow the one visitor. But again, that's not determined by us. That's determined by the state of New Jersey. The next big question on most mothers-to-be minds is, can you breastfeed? So let's ask moms or our audience, when you are COVID-19 positive, can you breastfeed? True or false? We'll give everybody a second to answer. And then as soon as those come up, we'll have Dr. Thomas tell us if we're right. Okay, so 66% of you do think that yes, you can breastfeed, and 34% of us think no. So let's find out.
Well, the current evidence suggests that even if you have COVID-19, breast milk is not likely to spread the virus to your baby. So you, along with your family and healthcare providers, though, should decide whether and how to start or continuing breastfeeding. It's a very individualized decision, but that's some reassuring information that we have that it's not likely to spread the virus to your baby. Breast milk provides protection against many illnesses, so it's the best source of nutrition for most babies. So if you can, it is really what's best. There's some helpful tips we can give, though, when we talk about breastfeeding. You should always wash your hands with soap and water for at least 20 seconds before breastfeeding or expressing breast milk, and that's even if you don't have COVID-19. If soap and water are not available, you should still use a hand sanitizer with at least 60% alcohol. However, if you do have COVID-19, in addition to that, you should be wearing a mask while breastfeeding and whenever you're within 6 feet of your baby. Overall, to keep people safe, we also recommend during COVID times to limit the number of visitors to see your new baby. We all know that having a new baby is a significant life event that typically brings families together to celebrate and support and, to visit mom and the baby. However, before allowing or inviting visitors into your home or near your baby, consider the risk of COVID-19 to yourself, your baby, and the people who live with you, and the visitors who may come later, such as grandparents or older adults and people who are also at increased risk from COVID-19. Bringing people who do not live with you into your home always increase the risk of spreading COVID-19. And some people without symptoms can also still spread the virus. So limiting the number of in-person gatherings and considering other options like celebrating virtually. I know it sometimes seems like we're a bit zoomed out, but it's a great way for people to see your new baby. If you don't have if you do plan, to have in-person visits, just ask guests if they're sick to please stay at home. And when people do arrive, do ask them to stay at least 6 feet away from you and your baby, wear a mask, and wash their hands.
That's good information. So let's ask the audience one last poll question. And I'm sure this is upmost on most people's mind. True or false? Is it safe to get the COVID-19 vaccine? So once again, we'll give everybody a minute to respond. And we'll see what people think. So 61% of the audience thinks that it is true, you should get the vaccine, and 39% think false. So this is a very interesting topic. So we'll have Dr. Thomas let us know what the recommendation is currently.
Well, I think things are changing day to day with what we know and how we feel about COVID-19. So I have to say, as with all things, specifically in this regard. It's such an individualized decision. You should talk to your provider about whether or not you as an individual would benefit from being vaccinated. Ironically, just yesterday, there was a statement put out by the American College of OBGYN and Maternal Fetal Medicine Society, because the World Health Organization put out a statement saying they recommend that we withhold the COVID-19 vaccine from pregnant women unless they're at a high-risk exposure. But American College of OBGYN and Society of Maternal Fetal Medicine are still holding true at saying that, well, we think it would be helpful. So we've decided that, we are going to stick with the current recommendation, even though the World Health Organization right now says something different. And it simply means that we need to take a look at this day by day, week by week, to see how we feel when we get data back about responses, reactions, and the current trends in the COVID-19 vaccine. So the good thing to keep in mind is that the vaccines do not contain the live virus that actually causes COVID-19, and therefore it cannot give someone COVID-19. Based on how the vaccines work, experts believe they're actually unlikely to pose a specific risk for people who are pregnant.
So if they do decide to get vaccinated, what are the side effects to the vaccine, and will they affect the baby? And are they different in pregnancy than not?
Sure. So side effects can occur after receiving either of the two available COVID-19 vaccines, especially after the second dose. The side effects are not expected to be any different for pregnant people than they are for non-pregnant people. Pregnant people, however, when they do experience fever following a vaccination, may be counseled to take acetaminophen or Tylenol because fever is associated with poor pregnancy outcomes. Tylenol may be offered as an option if they're experiencing this, but again, that's something that they should discuss with their healthcare provider. Some people have also experienced allergic reactions after the receipt of the vaccine, again, but this is not at any greater rate than people we expect to have this reaction who are non-pregnant.
Okay, so thank you for that information. Let's open up to our audience for some questions. We already have a number of them, and I will go through them and we can see what we can answer. So let's talk about the vaccine itself. So there are a couple of questions about the vaccine, and the first of which is, do you recommend getting the vaccine in the third trimester of pregnancy, or if you want to just speak to it all at once? One of the other questions is, if you've just gotten the second vaccine, when should you start to conceive?
When should you, I'm sorry?
Start to conceive. How long do you need to wait until you try to get pregnant?
Oh, wow. Okay, that's a great question. So I think just, as we just finished mentioning, even though WHO is saying maybe we should withhold ACOG and Society for Maternal Fetal Medicine, which are the guidelines that we subscribe to in this country, say that we shouldn't be withholding it. So I think that it's an individualized conversation you should have with your obstetrician gynecologist, just to make sure there are no other health-related issues that we need to consider in your particular case. I think that because we, again, are so new with experience to this virus and to post-vaccine expectations, I think, again, that's still another individualized conversation about whether or not you should wait a month or 2 or 3. There currently are not any written guidelines that say that you should wait any amount of time, even after delivery.
Okay. One of the questions is about, since it wasn't tested on pregnant women, but you did answer that question about the vaccine. So just want to make sure people know that ACOG and the Society for Maternal Fetal Medicine are absolutely recommending it. One of the other question is, how safe are other visitors to come and see the baby if they've already been vaccinated? Is there a concern there?
So I think that it's important that we remember that we don't consider vaccination an absolute way of making sure that we're not at risk. At this point, even when we're vaccinated, we're still recommended to mask and wash our hands. And I think we should take the exact same precautions. We've not been told that someone who's vaccinated is more safe than someone who hasn't been vaccinated. So I think Currently, because we are still going through the first rounds of people being vaccinated, and because of the limited data and experience that we have with COVID-19, we're maintaining that anyone who is not a member of your household, you treat them the same way. So I would say that the data's not out to say that anyone who is vaccinated is more safe at this point in time.
Right, right. There are a couple of questions about the protocols in labor and delivery, and if it's okay with you, I'll answer this.
Absolutely.
The babies are not removed. We do not separate moms and babies, even if mom is COVID positive. We just, as Dr. Thomas mentioned in the presentation, we just have mom mask whenever she's feeding the baby or within 6 feet of the baby, and wash her hands and do all the things that we've been telling people to do for a year now. So no, we are not separating moms and babies. And again, we really don't know about what happens after, right? So we are just maintaining all of our current guidelines. One of the other questions for you, Dr. Thomas, is what do you recommend as far as letting people see a newborn during COVID? And I think you did answer that.
Zoom.
Yeah.
Zoom is a great way to celebrate these days. It's our best, and I'm not promoting Zoom. Please don't take that from this presentation. Any virtual visit platform is awesome, because again, you get the opportunity to do what we normally do as humans, which is socialize and celebrate, but you do it in the most safe possible fashion without worry about anyone breaching any of the recommendations or rules.
Right, right. And then with Code Yellow, dad can be in L&D triage now, but what about a doula? So we did answer that doulas are always allowed. It doesn't actually matter even if it's code red for the visiting policy. In labor and delivery, you're always allowed your support person and a doula. So you should be good there. Here's a non-COVID related question, but this person is 8 weeks pregnant and would like to know how safe it would be to travel by airplane.
So that poses probably more risk, especially this day and age, given the fact that we don't have at this point in time any national guidelines or international guidelines for people with travel in terms of requiring masks or any repercussions for people who don't maintain that standard. It's certainly a lot harder to maintain 6 feet of distance when you're traveling by airplane. A lot of carriers have reversed their not having someone sit next to you rule, which was in place at the beginning of the pandemic. And certainly it's very difficult to wash your hands as frequently when you're on a flight after you may have touched things like the luggage carriers and the seat back tray and your seat belt. All of the things that I think we sometimes take for granted in how we go about our day to day. We're doing a lot of touching and moving and interacting that puts us really at risk. And that's why we have the mainstay of our recommendations of masking, washing our hands and staying distant. And I think that's very difficult to do in travel. Again, if there are special circumstances, I think that's something that you speak with your individual obstetrician, gynecologist about to make sure that there's something else or other things that we can do to try and help you be safe if you feel like you had to travel in an emergency. But generally speaking, it seems like it would be near impossible to maintain some of these guidelines that we have to stay safe if you're just going on routine travel at this point.
Mm-hmm. Okay. So there was then again a number of questions have come through about the vaccine and the trials, and knowing that some of the women who were in the trial did become pregnant during the trials. And the question are, is there any data on those women?
So I think the answer to that right now is they're still collecting data. I have not seen any individualized reports or studies about any of the patients that they're tracking. Obviously, we're all, waiting on the edge of our seat to see if there's some new information that we should communicate. But at this point in time, I'm not aware of any statements regarding outcomes that we should be giving to patients. So we're still waiting to hear.
Okay. And then one of the questions is, are babies tested for COVID on birth? And I can take that one. That unless there's an indication that mom is positive, and we do test moms, then we won't test the baby. And then one last question, how long is it recommended to keep the baby away from people outside of the house?
In general?
In general, I think. Mm-hmm.
Well, I think that, we go back to, we're still in the middle of a pandemic. So it's very hard to give people individualized advice about their circumstances without knowing some background. I think the safest answer is always talk about your particular circumstances with your provider to decide what the risks are relative to the benefits. There are no absolutes. We can just tell you that we know that there's a risk of getting COVID, unfortunately, still at this time, because we are still in the pandemic. And even though we're starting to, feel a lot happier about the thoughts of being vaccinated and maybe things changing soon, we haven't come out of the throes of this, and we still need to maintain our vigilance. So I would say still continue to proceed in the same cautious fashion of doing the things that we've talked about. Once again, social distance, wash your hands, wearing a mask. And if you have individual circumstances that you need to weigh the risk and benefits, please just speak with your provider.
Right. One of the other questions is, will we be offering virtual tours since in-person tours aren't allowed? And I can answer that one. We've already done all the videotaping for that, and they should be available very soon. So we did virtual tours of our Elmer location, our Vineland location, and our Mullica Hill location. There's currently a virtual tour of Mullica Hill, but not specifically labor and delivery. So and the maternity. So we did do that, and they should be available very soon. I'm sorry, I don't have an exact answer, but I can tell you we already did all the videotaping, so it should be soon. And then let's see. I think that's all we have for right now. Oh, I'm sorry. Will the virtual tours be in Spanish and English? Right now they're in English, but that's a very good question. And then, there are lots of questions coming in as we speak. Do mom and dad get a COVID test at any time during the hospital stay? So dads, we do screening, and for the mom, we do testing. Then I think we have time for one last question, because we are at the 12:30 mark, and I do appreciate everybody joining us. But should I put off fertility treatments until I get the vaccine?
I don't think that there's a reason to not pursue what's happening in the world of infertility, given the fact that, we're not sure of the timeline sometimes with how diagnosis and management of infertility may or may not interfere with your timeline of when you're hoping to conceive. So I would say I would make the appointment for the consult and then just be very frank about your concerns. And one of the concerns being conceiving during the ongoing pandemic. So I would say make that appointment and have that discussion at your visit.
Yes. So thank you very much for joining us. I want to thank Suze Plaskett-Bauer and Lauren Clinton, who are our background help for all these webinars. And Dr. Thomas, thank you for taking those, take your time to help everybody understand more during this pandemic. Thank you all.
It's been a pleasure.
Yeah, very good. Thank you.